People tell us every week that our information has helped save their life. If you agree that this is helpful information, please like, share, and most of all, subscribe, because nothing makes a channel like subscriptions. JMK 2129, are cardiovascular inflammation biomarkers better than stress tests for risk stratification when it comes to MACE? Cardiovascular events. The answer is yes. Oh gosh, again, please get the book. That's my whole point. If you consider defined standard as the most common form, your typical doc today in the US will start with his or her internal version of Framingham. And their internal version of Framingham is wrong. It's not what it's supposed to be. Even the standards committee will acknowledge that. So, are cardiovascular inflammation biomarkers better than stress tests? So your typical doctor will do in his or her head their version of what's called Framingham. Framingham is a small community about an hour from Boston, and there are more studies. It's a big database community for cardiovascular disease done out of that database than any other database that's existed. And so they say it's the Framingham risk calculator. And basically on a practical basis, what this turns down to is your doc saying, well, it's a 61-year-old male smoker with high LDL. You know, they're basically going through risk factors in their head. Framingham is wrong. It's not that it's not good. It's got its place, but it's way overused. And for the most part, I don't know if it contributes to more damage than good or not. That's a debatable point. On the one hand, it does help doctors coach patients that, hey, I've got some concerns about you. You've got some major risk factors here. But here's the next problem, which is problematic. Hey, why don't we get a stress test? Well, as I said before, a stress test is meant to predict heart attack, as JMK is asking. The bottom line is a stress test is not going to show up as a problem unless you've got 50% or more occlusion of blood flow into the heart. 2/3 of heart attacks occur in people that have plaque, but plaque that is less than 50% occlusion of blood flow to the heart. So bottom line, just that information right there, you tell me, are there better tests for risk stratification? I will say, yes, clearly there are. I would not rely solely on cardiovascular inflammation though. I would look at a couple of other things that are procedures that are fairly easy to get. A CT angiogram, a CT calcium score, or CIMT. Any of those will beat the stress test as a predictor.